I'm so happy you're on to talk with us, but really you are an exceptional person, an extraordinary person working in the mental health field. So glad to have you talking to me today, and tell us who you are and what you do.
So in a nutshell, I'm a clinical psychologist. My name is Dr. Kate Truitt, and I'm also a neuroscientist. I specialize in the fear brain, the amygdala.
I think the first thing we should talk about is, I would say, how to even process what's happening right now. And then I think maybe some advice on how to get through it.
Yeah. So how do we process what's happening right now? And to your point, this is an experience that our world has never been through. And there's been a lot of confusion from leadership, whether it be leadership in business, leadership in our recovery communities, leadership, at the greatest federal levels, which hasn't helped the situation. And, the one thing that I keep talking to my patients and my teammates about is we're in a time of social altruism in a way that we've never been in before. And the idea of altruism is I'm choosing to be uncomfortable for the greater good of my community, of my tribe, of all of us together right now, of my species, honestly. Altruism is a biological term. And we never in our lifetime, never in any of our lifetimes have we been called upon in such a unique and special way. And there's a wonderful opportunity here for us to show up for one another.
I love that answer. That's the only time I've heard that.
I've been thinking about it a lot, especially with social distancing. We are biologically wired towards attachment. And that term basically says you're in fear, you're in pain, you're worried, you're scared. Don't do what you're biologically hardwired to do, which is connect.
Right. Right.
And so the framework is really hard for people.
I'm a trauma survivor, and there's no, they're all different levels of trauma, but one of the things that, I love about your work, that I love about recovery, that, I know a little bit about your story, is I have a big community of people that are trauma survivors. And I think what's so paralyzing sometimes is that you can't get better. And my experience is you can get better, but life is always different. And it's really about learning how to react differently, learning how to self-soothe, learning these different tools.
I'm a trauma survivor as well, as you know. I'm developmental trauma, severe PTSD, sexual assaults, all the things. And one of the things that's been so interesting to personally notice during this time, part of my brain is saying, okay, the best way to handle this is to just have a little whiskey. And I'm noticing that pull. And it's really interesting to be in relationship with that, because I'm noticing that my brain and my body are struggling with a really hard time right now. And so that pull makes sense to me, because my brain and body are hardwired to know that in hard times, this is the thing I go to. And actually, one of the things for alcohol specifically is alcohol puts our brain into an alpha wave state, which is calming. And when we're in a state of hypervigilance, we're in beta gamma, which is agitated brain waves or higher frequency brain waves. And so the alcohol goes, okay, you can be calm down, you're okay. And so I'm trying to hold a lot of compassion for myself when that thought comes up and go, okay, you're stressed. That's what that thought means. It doesn't mean go for it. It means your brain is tying into an old pattern.
Well, you are proof, I am proof that you can recover from all of this and be a productive, contributing member of society.
If your brain's fighting against you, it is possible to get better. And holding space that in the hardest times, if your brain's doing things that seem confusing or conflicting, your brain's still just trying to survive. Your brain's on your side ultimately for survival.
Yeah.
And so that's the radical love. That's the compassion, because shame will just make everything harder. Right. And really, your brain's on your side, even when it doesn't feel like it is. So at Dr. K. Truitt and Associates in the Trauma Counseling Center, everything that we do is focused on empowering our patients, our clients, to take their healing into their own hands. And so as we're navigating this experience, we have a anxiety group that's online. We have chronic pain and chronic illness groups, a specific one for men and one for women. And given the health anxiety that's coming up with the coronavirus and knowing the idea of vulnerable populations, having those groups available is really, really, really important. Mm-hmm. And they all include the self-havening and doing your own self-healing. So we have a lot of new content that'll be coming out just in the webinar space. So again, we can get the information into people's hands and say, here's how to do your at-home healing program.
Right.
And then if you would like a little additional support, call us. We're here and we're going to help you build your at-home healing program and do a little more intensive work with a practitioner so that you know how to do your own work in the moment.
Because you know what? This may be the new normal. So you better learn how to do it now and help yourself through the process.
And can I plug your books, by the way, and just say they are phenomenal books. We have been sharing them, and they're beautiful. And so, make sure you link your workbooks because, Lindsay, they are such a gift to all of us. And they're absolutely gorgeous and so healing.